Jen? Jen, did you fall asleep? Oh, right. That's not Jen. All right, go ahead.
Can you hear me? Oh, well, with microphones. Well, do you know any quiet people, by the way? These guys are like yelling and stuff.
I haven't seen us sailors yet. That was Army.
An observation and two questions. Back about 10 years or so ago, I used to work for a large, local, to be unnamed insurer. And something discussion about that is a memory, like the phrase that they always used to use, low and hanging fruit. And also, if Chris is still here, I don't know if he's still here, but the large groups that were insured, often the CEOs, the guys that ran it, and they were unfortunately called out at the time, got the Cadillac plan, but their employees got low HMOs. So that's what the company would negotiate with the insurer. I don't know if Chris knows that, that's what goes on there. Oh yeah, well I was there. I'm not good after my brain injury. I'm not really good with statistics, I can't say that word, and memory. Or a lot of noise even, I'm not good either. But I know there is some sort of chart of how nations are rated in terms of healthcare. I don't know if it's excellence in healthcare or mortality, morbidity. I know there's a rating. Where is the U.S. on that rating? And where are the countries that have been used as the scary countries, like Canada, France, and England? Are they above us? Are they below us? I think you know the answer, I don't remember. And I guess the other question is that this is a very emotionally loaded topic. It involves people's personal lives. There are a lot of rumors going around, a lot of things being ads and stuff to engender that emotionality. A lot of rumors are not true, and you see some of that here. How does somebody like you, well-meaning, well-spoken, have a really great handle? Your first politician I've heard with a really good handle. And it's something like you get the message out there clearly against some of this emotionality that's been built on rumors and ugly truths. So I guess those are my two questions.
Thanks. The first one is, you know that the United States in child mortality and other indices is down below a dozen. I mean, she said 30 seconds, the exact number. What is it? 37. 37, all right? Now, I'm going to answer that, and you may not agree with my answer because I don't have statistical proof of this, and I'm taken with trying to do it first with the facts on the table, then argue rather than coming at it from ideology. But I believe, so this is an I believe. You know, when my daughter had her cancer, I wanted a doctor in the United States. I'm sure there's new ones elsewhere. See, I honestly feel the quality of healthcare we have here, if you have access to it, is premium. And so, if you were able to have everyone have access to that quality care and be able to afford it, I believe you would be up there with other countries, if not even above them. But I don't have a study that can show you that that's true. Pardon me?
I don't think it's always that excellent, and I see things in
No, you have to be, you're not wrong. There are, it's like that tort reform question. I mean, now, and part of that is, you know, my father had staph infection. Let me just tell you, a staph infection cost the hospital about $140,000. And they're very preventable. I think it's the VA hospital in Pittsburgh, they hardly have any staph infections. Why? Because it's mandated, you will change your gown 7, 8 times a day. You will wash your hands out. So very preventive ways to do things. Changing the incentives and all, have a way to do it. And I think it's the hospital, the VA in Pittsburgh. Take medicine. I remember checking, I'm a Navy guy, into details. So whenever the chemo would come, I'd go down the bag and check. We found 2 mistakes. Now, they were minor mistakes, but you get electronic, you know, where the pharmacist types it in, it goes all the way by wireless right into the bag. You know, you can stop some of this. And so there's some, but these are hard things to convince people that they're worth the initial payment to savings are attendant down the road. Now, the second part of your question was,
how to get a sensible message out there, how to make sense to people without all the ugly rumors and truth.
oh, look, this is what we're doing tonight. I know Chris from a year or two. I mean, the group of men and women that he goes around with are, he's been where I have in Tampa. I respect that man. He and I have, he has my cell phone. He called me today because he had heard that that seats had been passed out by tickets, and that's not fair. I said, absolutely. Remember, I asked, I said, is this, and he said, no. Look, my part of what unfortunately politics has become is the art of cleverness. Being able to make your case by innuendo and other things. But all that said, I'm telling everybody here that if you've been with me when I traveled throughout this wonderful Commonwealth, people are anxious. And it's our job to do this. Bill Walsh, I went in the name with him in 97, keeps our office open 7 days a week. Call us tomorrow night. He's here today at 9 o'clock at night. Because we run in the military. I mean, people think military are clones. Well, you see here they're not. They have opinions. But you listen to your troops and you're accessible to them if you're a decent leader. And that's how we approach it. Government, for too long, has not been accountable in the sense of, you know, it's my job to be up here and do this. I mean, Bill today has been trying to arrange for another town hall in Upper Darby to do this. And we're going to do it. We're having one of those telecommute calls, but I didn't want to do one of the telecommute ones until September because I didn't want anybody saying, oh, you're hiding behind a telephone. You know what I mean? I don't want this stuff. I love this stuff. Because it's my job to give back. And look, to be quite frank, I think the Democrats can have done a better job, quite frankly,